Hi everyone, I am Dr. Karishma, plastic surgeon from Bangalore, and today we are going to answer some of the frequently asked questions about breast augmentation or breast enhancement using a breast implant. Yes, breastfeeding and nursing is definitely possible with a breast implant. There is no scientific research or medical study which states that breastfeeding is not possible with an implant in place. Most of the women who undergo a breast implant surgery are usually in their early 20s, and many of them are young and before getting married is when they do a breast implant. Although there are women who also want to do a breast implant augmentation much later after they have completed their family life and they have lost the volume of the breast. When it comes to breastfeeding and nursing, there is absolutely no problem. However, in a rare circumstance, as you all know, there are women who have small sized breasts and have difficulty with breastfeeding, irrespective whether they have done an implant surgery or they have not done a surgery. But there is no direct correlation between an implant and not being able to breastfeed. Yes, there is absolutely no problem with pregnancy, childbearing or nursing after a breast implant surgery. There is no connection to what the body is undergoing when we get pregnant and doing an implant surgery. An implant is placed into a breast pocket which is created either underneath the breast tissue or underneath the muscle on the chest level. So you can definitely go for your pregnancy and you can nurse the baby. So breast implant surgery can be done between the ages of 18 to up to even 60 and 65 years of age. It all depends how motivated you are, how realistic you are. But I would not suggest to do a breast implant below 18 years of age, because by the time you are 18 to 21, your body is fully developed. Also psychologically, you know the pros and cons of doing a breast implant surgery and you're completely sure in the mind that you want to go ahead with this decision. Well, breast implant surgery is one of the most simplest procedures in cosmetic surgery. It is only a 40 to 45 minute surgery. It is a daycare procedure. You come early in the morning and you can go home post lunchtime. The procedure is absolutely not risky. It can be done under sedation with local anesthesia. In a few patients who do not want to be awake during the procedure, we put them to sleep and do it under a quick, short general anesthesia. The breast implant procedure takes only 40 to 45 minutes. It is a very quick procedure. Very small cuts are made underneath the breast or inside the armpit area, and the implant is placed inside a breast pocket. This breast pocket is usually behind the breast tissue or behind the chest muscle. So it is only a 40 to 45 minute procedure. After the procedure, you are alert and awake within 10 minutes. Yes, you will have a dressing and a small plaster on your breast after surgery. We will make you wear a supportive bra along with a chest band. Now, this chest band is extremely important and it helps to stabilize that implant. A chest band is like an elastic band which we wear on the top of the chest along with the sports bra and a small dressing. We open out your dressing about 2 to 3 days after the procedure, and after that you can take daily normal showers, and all you have to do is dress up a small little wound with a little ointment and a gauze. This is the commonest asked question and everyone is worried about the recovery. Well, let me tell you, it is a very smooth and easy recovery. My patients go home the same day after the surgery. They are absolutely alert and they're wide awake. By the second and third day, they're getting back to their routine house activities. Of course, there is slight pain on the chest region. There could be a little pain on the shoulders or a little bit on the back, but all of this discomfort is relieved with the pain medications that we provide. And by the 4th or 5th day, you're good to start your daily house routine. You can get back to your work, you can get back to your office within a week. Well, just to let you know, you do not need any kind of bed rest after a breast implant surgery. You will be up on your feet. Many of my patients who come for a breast implant procedure come by themselves and they go by themselves. But we do insist our patients not to go back because they have just completed a general anesthesia procedure. So we do encourage them to get a relative or an attender or a friend along with them to take them home. But they are absolutely awake by lunchtime. They have their lunch, they leave, and there is no bed rest required. You get on to do your basic daily home activities. The only few restrictions is not to lift heavy weights for about 3 to 4 weeks. Try to avoid driving for about 4 weeks. Try to not activate the chest muscles too much in the first 3 to 4 weeks till the implant stabilizes itself in the breast and takes shape. Gym activities, strenuous exercises, yoga, sport activities are all restricted for about 4 to 6 weeks. You can go for your daily walks. You can do mild cardio exercises from the 3rd week onwards, but we do want to restrict the muscle movements on the chest where the implant is sitting. Now the implant may be sitting in front of your muscle or behind the muscle. So this muscle is in constant movement when we are performing all these kind of gym activities. So we tell our patients to avoid any kind of strenuous activities for about 4 to 6 weeks, and then you can do what you like. Don't forget to press the bell icon and keep your comments, and we would like to answer your comments. Please like our videos. Watch out for more videos in the future.